Good morning. My name is Isabel Martinez, and today I'm going to be presenting the muscular system. This is Bio 201 with Professor Kosar. So, what is a muscle, you might ask? Well, a muscle is a band or bundle of fibrous tissue in the human or animal body that has the ability to contract, producing movement in or maintaining the position of parts of the body. And we have different types of muscles that can be found within the skeletal system. So, those consist of the fusiform, the parallel, the convergent, the unipennate, the bipennate, the multipennate, and the circular. Beginning with the fusiform muscles are thick in the middle and tapered at each end. And an example of a muscle which would be a fusiform muscle is the biceps brachii of the arm and the gastrocnemius of the calf. And moving on, we can see that the parallel type of muscle actually is fairly uniform width and has parallel fascicles. And examples of these types of muscles contain the rectus abdominis of the abdomen, the sartorius of the thigh, and the zygomaticus major of the face. And these parallel muscles can be span long distances, such as from the hip to the knee, and they shorten more than other muscle types. The next muscle type on our list would be the convergent. And convergent muscles are muscles where the origin or the attachment to a fixed bone is usually wider than the point of insertion. So, an example of a muscle on the chest is the pectoralis major, and this is an example of a convergent muscle because it converges on the greater tubercle of the humerus via the tendon. Next on our list, we have the unipennate muscles. And in a unipennate muscle, the fascicles are located on either side of the tendon. So it's actually just going to be one side of the tendon. And the extender digitorum of the forearm is an example of a unipennate muscle. And a bipennate muscle, which is going to be next on our list, has fascicles on both sides of the tendon. So that's the difference between the two of these muscles. And you can find these muscles, as in the bipennate muscles, they can be found in the rectus femoris of the thigh. Next on our list, we have the multipennate, and this muscle is shaped like a bunch of feathers with their quills converging on a single point. And I like to use the example of the deltoid muscle to describe this type of muscle because it is located on the shoulder. And if you look at the image here, you can see it is sort of similar in shape. And the next and last type of muscle that we have is going to be the circular muscles. And these form rings around certain parts of body openings. When they contract, they consist of openings and they tend to prevent the passage of material through it. So, examples of these would include the orbicularis oculi of the eyelids and the anal splinters. And smooth muscles can also form from these types of muscles. So, those are just a couple of types of muscles that we can find within the skeletal system. Moving on, there are connective tissue components that make up the skeletal muscle. So, beginning with the endomysium, these are thin sleeves of loose connective tissue that surround each muscle fiber. And then we have the paramysium, and these are a thicker connective tissue sheath that wraps around muscle fibers together in bundles. And these bundles are referred to a term called fascicles. And moving on, we have the epimysium. And the epimysium is a fibrous sheath that surrounds an entire muscle. And then lastly, we have the fascia. And this is a sheet of connective tissue that separates neighboring muscles from each other. And these muscles are grouped in compartments separated from each other by the fasciae. So there are different functions of the skeletal muscles, and they consist of movement, stability, controls of body openings and passages, heat production, and glycemic control. So, movement allows the muscles to move from place to place through individual body parts, and they allow the body to move in the course of breathing, blood circulation, feeding and digestion, defecation, urination, and childbirth. And the function of movement serves in communication roles such as speech, writing, and facial expressions that can be visually seen on the face. And next, moving on, we have stability. And these muscles maintain posture by preventing unwanted movements. They resist the pull of gravity and they prevent us from falling. And they also stabilize the joints by maintaining tension on the tendons and bones. Next up, we have control of body openings and passages. These allow muscles encirculating the mouth to serve for food intake and retention of food when we chew and digest our food. And they also encircle the anus and control the elimination of waste. And muscles in the eyelid and pupil regulate the admission of light to the eye. The fourth function is going to be a term referred to as thermogenesis, and this is also another fancy name for heat production. And surprisingly, the skeletal muscles produce about 20 to 30% of the body's heat, and up to 85% of heat is produced during exercise. So, this is actually really something surprising and interesting to take into consideration because this is actually a very, very, very important function because it is essential for the functioning of enzymes and metabolism as a whole within the body. And the last type of function that we have is glycemic control. And this type of function is able to regulate the blood glucose contraction within its normal range. So it allows the skeletal muscles to absorb, store, and use a large share of glucose. And also, it allows the body to stabilize its blood concentration. So, this is super important within the body, especially for people older in age, possibly with diabetes, type 2 diabetes specifically, um, because stabilizing one's blood concentration allows for the body to be healthy and fluid in its everyday functions. So, after reviewing all of those facts really briefly, we just have a trivia time. Which of the following are functions of skeletal muscle? We have A, produces movement, B, maintains posture, C, both A and B, or D, none of the above. I will give you 5 seconds to think of your answer. And the answer is A, produce movement. So moving on, we're going to start to divide these muscles into different sections within the body. So we're going to start with muscles of the head and neck. We're going to identify a few of these muscle terms and find their locations within the body. So starting with the buccinator, the origin of this muscle is going to be the maxilla, and this is going to be literally right near the cheek area. And then we have the digastric muscle, and the origin of this muscle is going to be the digastric fossa of the mandible. Skipping the frontalis and moving on to the levator labii superioris, we have an origin that lies in the zygomatic process of the maxilla. And then we have the masseter. It's going to be located in the maxillary process of the zygomatic bone. So these are all kind of making up the facial structure of the face. And you would actually be surprised how many muscles are found within the face. Your face actually has almost 20 muscles within it. So, that is just a super fun fact to consider because this allows our face to perform everyday functions such as frowning, smiling, chewing, depressing of the mandible, etc. Um, Another term we can go over is the mylohyoid, and it is located within the mandible. And we'll just do a couple more. We're going to go ahead and do the splenius capitis. The splenius capitis is going to be located within the neck. And then we have the scalenes. The origin of the scalenes is going to be the cervical vertebrae. And last but not least, we will go ahead and do the temporalis. The temporalis origin is going to be the temporal fossa. Next up, we have muscles of the chest. And muscles of the chest, or in other words, the trunk, these are super, super important for our body because these are muscles of respiration. And the way we breathe, the way we inhale oxygen and exhale carbon dioxide within the body, um, we do this by means of muscles that enclose the thoracic cavity. So, without these muscles, the respiratory system would have a lot of trouble performing its average duties. And so, below are a few examples of skeletal muscles found within the chest. We have the external intercostals, the internal intercostals, the pectoralis major, and the pectoralis minor. So, I've just gone ahead and included a few images of these types of muscles and where they can be found in your own body. And I do have one trivia question, and the question is, which of these following muscles of the chest has its insertion of the humerus? And I'm going to go ahead and give you 5 seconds to answer. Ready, set, go. All right, perfect. Time is up, and the answer to this one was the pectoralis major. The next portion of the body is going to be our back. So these are a few muscles of the back. We have the latissimus dorsi, the rhomboid major, the serratus anterior, and the trapezius. I've included visuals for all of these muscles just so you can go ahead and take a peek. And the importance of the muscles of the back is they are the main structural support for the trunk or the torso. And these muscles will help you move your body. They move your body as far as like the head, the neck, the arms, the legs. And if your back muscles don't work together, you wouldn't be able to bend over, twist, turn your head, extend your back. So these are like super, super important functions. And they also just provide a lot of support. Um, Even just think about like just walking around every day, like we need those muscles to support that region right near our spinal cord. And so this bonus question that I have for you guys today, following the trivia question, we'll start with our bonus question. It's going to be the muscles that laterally rotate and depress the scapula, as in shrugging and lowering the shoulders, are. I'll go ahead and give you 5 seconds to answer this one. And time's up. This one's going to be the trapezius and the serratus anterior. So those are going to be the last two muscles found on this slide. And the first question that we have is going to be, which of the following muscles adducts, extends, and internally rotates the arm? I'll go ahead and give you 5 seconds to answer. All right, time is up. And the answer to this one, if you got it correctly, was the latissimus dorsi. Muscles of the abdomen support the trunk, allow for movement, and they also hold our organs in place. Um, they regulate an internal abdominal pressure, which allows it to do so. And here I have included just 4 examples of muscles of the abdomen. We have the diaphragm, the external oblique, the rectus abdominis, and the transverse abdominis. Sorry, it's going to be rectus abdominis and transverse abdominis. I've included their origin, insertion, and action. So starting with the diaphragm, the origin is going to be the lumbar vertebrae of the spine. The insertion is going to be the xyloid process and the costal margin. And the action, it's going to contract and flatten when we inhale. And next up, we have the external oblique, as mentioned previously. The origin of this muscle is going to be the external surfaces of ribs 5 through 12. The insertion is going to be the lineba albi, and the action, it's going to flex the chest. And the third muscle we have here is going to be the rectus abdominis. The origin is the pubic symphysis. The insertion is the costal cartilages of ribs 5 through 7. And the action of its function within the body is it's also going to flex the chest. Lastly, we have the transverse abdominis. It is located as an origin within the iliac crest, and the insertion is going to be the pubic symphysis. And the action of this muscle specifically is going to be to maintain abdominal tension, just as I was referring to before. We really have these deep abdominal tissues to make up the core muscles and help our body remain stable, balanced, and all in all protecting the spine, as I said previously in the last slide. So next up, we have muscles of the leg, and as you can assume, our legs are super, super, super helpful for us. And without these muscles that are listed, we have the extensor digitorum longus, the gastrocnemius, the soleus, and the tibialis anterior. We wouldn't even really be able to walk. So these muscles are being used as early as those first steps. So these are super, super important for our body. And I'm just going to go over their origin, insertions, and actions. So starting with our extensor digitorum longus, the origin of this muscle is going to be the medial surface of the fibula. The insertion is going to be the distal and middle phalanges of digits 2 through 5. And the action is going to be extends the lateral four toes, and we have the gastrocnemius continuing on. The origin is going to be the medial and lateral supracondylar ridges. The insertion is going to be the posterior calcaneus. And the function of the gastrocnemius, it provides super powerful plantar flexion of the foot. So it allows us to point our toes, such as a ballerina would if she were to point her toes when performing a dance. The soleus is the third muscle we're going to mention. It has an origin as the medial border of the tibia, and the insertion is going to be the posterior surface of the calcaneus. And same here, the soleus also provides plantar flexion of the foot. Lastly, we have the tibialis anterior. The origin is going to be the lateral surface of the tibia, and the insertion is going to be the base of metacarpal 1. The action of the tibialis anterior is it dorsiflexes the foot at the talocrural joint and inverts it at the subtalar joint. So these are our muscles of the leg. These are not all of the muscles of the legs, but just a few of them. And just keep in mind that these muscles, they're gonna allow our body to move, carry the weight of the body, and also they support us when we stand. All right, we just got through a lot of information, so we're going to go ahead and do a trivia to see how much knowledge you have really gained. So, starting with the leg muscles, which one of these leg muscles is commonly called Taylor's muscle and allows one to sit in a cross legged position? I will give you a hint. This is going to be the longest bone in the body. So, I'll give you go ahead and have 5 seconds to answer this question. All right, time is up. And if you answered B, sartorius, then you are correct. Next up, we have the answer to this one is going to be hint, hint, a shoulder muscle. And this muscle works as a fixator of the shoulder when you attempt to lift a heavy table with your forearm. I'll go ahead and give you 5 seconds to answer. All right, awesome. If you answered A, deltoid, then that is the correct answer. And lastly, this shape of this muscle gives it its name. I'll give you 5 seconds. All right, if you answered trapezius, then you are correct. Great job. I hope you learned a lot. We're going to go ahead and move on to the next slide, and we're going to keep learning about the muscular system. All right, next up, we have muscles of the shoulder. And these muscles are actually, I would say, the most prone to injury, especially among baseball players, softball players, any sort of sport that is maintaining the widest range of motion. So, for example, a baseball pitcher, for example, would be a perfect example of this. This flexibility of the shoulder joint is what actually allows the shoulder to be prone to instability and injury. So, muscles, tendons, and ligaments combined keep your arm bone in your shoulder socket, but your shoulder can be easily dislocated. So, starting off, we have the deltoid, and its origin is going to be the scapula. Its insertion is going to be the humerus. The action of this muscle is going to be responsible for arm abduction, so the movement of the arms away from the body, and they are constricted with three main sets of fibers, and that's going to be the anterior, the middle, and the posterior. Then we have the rotator cuff muscles, which include the supraspinatus and the infraspinatus. The supraspinatus is the abduction of the arm, and the infraspinatus is going to be the action of this muscle is going to be the glenohumeral stability. And both of the insertions for each of these muscles lie within the greater tubercle of the humerus. Lastly, we have the teres minor. The origin is going to be the scapula. The insertion will be the humerus. The action of the teres minor is going to be the external rotation of the shoulder joint. And the teres minor actually helps to maintain shoulder stability. Super duper important so that there isn't too much flexibility around that joint. And like I said, uh, there is a possible way that the shoulder can be dislocated, but the teres minor keeps that shoulder intact. And so, next up, we have our trivia time. The question of this slide is going to be a baseball pitcher who injures one of his sits muscles most commonly sustains tears to a tendon of which of these muscles? I'll go ahead and give you 5 seconds to answer this one. All right, awesome. If you answered supraspinatus muscle, then you are correct. All right, moving on. This is going to be the last group of muscles we are going to cover today. We have muscles of the arm. So these include the biceps brachii, the triceps brachii, the brachialis, and the coracobrachialis. So, as you can presume, muscles of the arm help us with the littlest of movements and all the way up to the biggest of movements. So, little finer movements such as wiggling your fingers, maybe, tying your shoelaces, they also help us do big movements like straightening your elbow, raising your arms above your head, performing a push up, performing a lateral pull down if you are one who works out in the gym. So you can just think of like all of the different functions that our arms allow us to do in our everyday life. And so starting with the biceps brachii, the origins for the long head is going to be the supraglenoid tubercle of the scapula. The short head is going to be the tip of the coracoid process of the scapula. The innervation is going to be the musculocutaneous nerve, and these are nerves C5 through C6. The action is it flexes the elbow joint and it supinates proximal and distal radial ulnar joints. Next up, on the top right corner, we have the brachialis. The origin of this muscle is going to be the distal anterior humerus. The innervation of this muscle is going to be the musculocutaneous nerve or the radial nerve. And this muscle also allows us to have flexion of the elbow. Bottom left corner, we have the triceps brachii. The origin is for the long head is going to be the infraglenoid tubercle of the scapula. The innervation is going to be the radial nerve, and these are radial nerves C6 through C8. And the action of this muscle is going to be extension of the forearm at the elbow joint. And lastly, but not least, we have the coracobrachialis, and the origin of this muscle is going to be the coracoid process of the scapula. The innervation is going to be the musculocutaneous nerve, and these are nerves C5 through C7. and the action is going to be the adduction and flexion of the arm. This muscle is a long and slender muscle of the anterior compartment of the arm, and as its name suggests, it extends from the coracoid process of the scapula, as I suggested before. And all of these muscles, like I said previously, they allow us to do super small minor movements and super big major movements. So without our arms, honestly, we wouldn't really be able to function the same. Thank you so much for tuning in today. I hope you were able to gain a lot of information. I know I was when I was going through this information and I was first learning about the muscular system, because it's super fascinating just to know like everything that is located deep within our tissues and deep within our bodies. So, thank you so much, and I will see you and talk to you guys later. Thank you.